me to record this session. So, yes, we'll jump right into it. So, I graduated from Dow Medical College in Karachi. Not many of you are from Pakistan. So, this is one of the largest medical universities in Pakistan right now, back in 2001. So, a fair while ago. I did my PLABs, was in the UK, and then I've been in Australia. It's been about 21 years from being an IMG and obviously being in two countries. And then, yes, obviously, I'm working as an emergency consultant here for the last 8 years in two hospitals, which are quite busy. But I like to help lots of IMGs. So I'm also co-country liaison representative with someone else from Hobart for Australian College of Emergency Medicine. And look, what I like to do, so that's my job, which keeps and pays my bills. But what I'd really like to do is I'd like to, do courses for IMGs, for doctors. We're also doing applications, interviews, and career guidance. So we sort of big in that space right now. We have developed, thanks to all of the guys, some sort of YouTube following. So we've got about 23,000, a bit over on YouTube, Facebook. So close to about 50,000 followers on all the platform. And it's a very integrative and very interactive platforms. We get lots of comments, which sort of fuel the discussions as to what we'd like to put on. So that's about me. So if you want to get any more information, that'll be on YouTube channel. And that's it. No, I'm joking. I'm joking. That's just a start. Um, I'll get Dr. Simra to introduce herself first. I should have started with Dr. Simra because she's a lady and ladies normally are first, right? So my apologies,
All
Dr. Simra.
good. No, all good. So, hello, my name is Simra Siddiqui. I'm one of the IMG from Pakistan. I have started my journey in Australia back in 2021. I completed my WBA in one of the hospitals in Victoria. And after that, I have just started my psychiatry training in one of the Western Network in Sydney. That's my job, which I do. But like as I'm Rizwan is one of my mentor who always helped me and always motivated me to be on the right track. And I believe that's why I am one of those lucky IMGs who are able to do everything on time and get into the training straight away. Apart from that, yes, as I am inspired from my mentor Rizwan, I want to join with him. And I am currently working as a career counselor with Rizwan, and I'm helping JMOs to get into the system. In the lab, we have just launched one of the course with Rizwan, and luckily we are able to secure like more than 50 IMGs into the system in the last 2-3 months. So that's what I'm doing as my passion. And yes, I'm here to have some insight about training and guidance to you all.
Yeah, that's very insightful. And Dr. Simra has got a very good story, and I'll tell you someday. Um, but let's just start. Look, I think I want to change the mindset a little bit. Now that I know that what you all want to be, but majority, I'm getting a feeling want to go into a general practice, which is you're not alone. You're in good company. Almost 50 to 60% of the international medical graduate would like to go into general practice. Now, that's not a bad decision, as per principle. That's how things are, and I respect that. I just want to create a bit more flavorful approach that look, there's more options out there which might be even more lucrative than working in general practice. And I'll tell you why and how. And obviously, I mean, general practice is brilliant. It's a good field to establish yourself, to being an entrepreneur, opening up multiple medical centers. But there's some more life to it than just being a general practitioner. What we're seeing now, we often model ourselves behind the UK model. So what we're seeing now is a bit of an oversaturation in UK markets in general practice. The general practice trainees are not being able to find jobs properly, substantive position in the major cities. Even the rural location locum jobs are becoming quite tricky to get. And some of them are working in part-time capacity, often doing locum in SHO capacity. So I think this is a good place to start that discussion as to what else is out there in addition to the general practice. So I might just ask, what do you think is the difference between the first and second job? Anything that you feel. Obviously, you have been in the system for a long time. I'd like to know, what do you think is or was the difference between your first job and a second job? Come on, you can't be wrong. You can say anything, and I'll love you for that. Just throw anything off.
It's experience. The second job you have already the first job experience, so
Mhm.
really helps with your mindset, everything, because you know already how the
Wonderful.
system works. So experience, I think it's one good point.
So I think the first job is more like an experiment, and second job is more like an experience building onto that experiment. I wouldn't agree more, but I think the first job is an opportunity that you're all looking for when you come into any new country, be it UK, US, or even Australia or Canada. And the second job must be your career choice. This should be strategic. This should be a plant, a seed planted there right now. We often, I'm an hour about what we want to do. But the second job, your second job might be a year later after the WBA program, but it needs to be focused towards a goal, be it a GP, be it a specialist, be it a surgeon, or emergency physician or critical care doctor. It must be focused in that direction. Now, and I'll tell you why. Look, these are some of my friends who would like to share the picture with. So these are the doctors who I've worked or have had a pleasure of working with them. They're all now working as a consultant. So this is a doctor who I'd worked with when I started out at Sutherland Hospital. And I asked her once that, look, what do you want to do? And she said, I want to do, anesthesia. And I said, yes, right. I knew anesthesia is super competitive. And lo and behold, she got herself an unaccredited position and then a accredited position. Now she's working as a consultant anesthetist in Liverpool Hospital. Another doctor from Kerala, India. So she was my resident when I was working as an emergency registrar in St. George Hospital. And she said that I want to be a basic physician's trainee. I'm not quite sure what I want to do. And I was recently, her husband is a good friend of mine. And she told me that her wife, Dr. Ayyal, is now working as a consultant hematologist in Newcastle. Now, this is my very good friend, Dr. Wasim Hassan. I'm not sure. He was very popular. He is now working as a consultant emergency physician, but he is a gold medalist. So he won Buchanan Prize for a fellowship exam in the College of Emergency Medicine here in Australia. Now, this is a person which I'm most thankful to. His name is Dr. Arvind Iyer. Now, he's working as a cardiologist in Wright Hospital. He's from India, and we used to work in the UK together. And I remember one distinct day is he was filling up some paperwork and some application form. I said, Arvind, what's happening? And he said, I'm going to Australia. And I said, okay, Australia? Can you do that? He said, yes, I'm going there. So he was the person behind my move to Australia. And I still remain friends with him. He's now working as a consulting cardiologist. This is my class fellow, Dr. Noman. He's working as a radiologist. Dr. Imran, who's working as a cardiologist. Very leading gynecologist here. So you can get into surgical field. And then we've got our Dr. Saul, who is also working as an orthopedic hip and knee replacement surgeon. Very good private practice. So the point of showing this slide is that you can do anything you want. These are all the people with families. They're all the people coming from different backgrounds, different cultures. There's nothing which should restrict you, or you should not have the default mindset, I want to become a GP. You may like to become a GP if you really love it, but if you love something else, regardless of your age, it's worth pursuing that. Now, I'll give you some differences. Yes, it's very easy to get into general practice training, and specialist entrances are often competitive. Your overall training time in GP practice is about 2 years, give or take. Most of the specialist training program are about 5 years, and then you have to do exams to enter, exams to exit. You got flexible working option, but work options for specialists are even flexible. I work part-time, and now my major work is obviously working here as at Emergency Focus. Now, more and more new GPs are getting pushed more and more further away to rural regions and remote locations. So trust me, if you start up a GP program, you'll find yourself somewhere sitting in Monash with MM2 score 3 DPA area. So you'll be far away from an urban civilization. So be very thoughtful about that. Now, being an emergency medicine training, and often Simra, we work in Sydney. I trained all my jobs in Sydney. I lived in Sydney. I have got a house in Sydney, and Simra is also working in Sydney. So being an IMG, you can pretty much train and even work in the major cities: Sydney, Melbourne, Brisbane, Queensland, Sunshine Coast, wherever you are. There will be moratorium restriction imposed on you as a GP for 10 years, and there's no you'll be restricted in terms of where you work. There'll be very little chances of moving up the ladder. Not even you can do locum from that. Your prescriber number and provider number will chain you down to that area. But even though with the moratorium restriction, the jobs are as such, there is a demand in urban and regional centers, so you will be able to move around a bit more flexibly. And there are stable permanent job. When you talk to specialists, we get star specialist contract, which are stable, they're permanent. And as a GP, you have to see set number of patients. You get billed by set number of patients. So if you see 40 patients, you're in good luck. But if patients are not turning up, your center is not busy, or whatever reason, you'll be earning less. So be mindful of this situation. And plus, I've given you an example from the UK, where the GP market is now completely overflooded. And now they are doing hospital locum to compensate for their income. And I think Australia is not probably far away. So I would like you to think what you love to do and how would you plan to achieve that love, that career love, not the other love, the career love. So have a plan A, have a plan B. And, we often talk about job. I want to break that sort of mindset. It's more about careers. Job could be, yes, obviously individual jobs here and there. But I think if you're career oriented, your jobs will maximize everything from your personality, your qualifications, your speaking, your interaction, everything will be professional. So you need to have relevant clinical experience. You need to have a right set of qualifications for what you want to do. You need to have a desirable credentials in order to achieve what you want to achieve. And only when you got these three things, then your CV and interviews will start looking like legitimate thing. You won't be faffing about on your interviews. And that's what I want to highlight. And I'll show you how it's possible. So I want to work on an action plan with you guys today. And it's not like a one sitting thing. It's not like we can do in a couple of hours right now. It is something which we work on over a number of days, weeks. We've got currently about 86 or 87 doctors, Dr. Simra. Yeah, 87 doctors that we're working with. And it's one very important journey. We feel privileged to be part of their journey. And I think they are very thankful that we are trying to reinvent different ways of working on the things which matter and ignore the things which don't matter. Okay. And they're following up those advice. So your good performance in your registrar year will help shape your registrar years. Okay. So this is a very important mindset. So what is the action plan of growing further? Now, as you said, most of you are in this category, PG year 1 and year 2. And this is a very important time of your life. Trust me. The right foundation at this point will help pace your future medical specialty, general practice specialist, surgical, radiology, anesthesia, whatever it is. So obviously, most of you would have already completed 12 months of RMO experience. You may have been studying for AMC clinical, but now you're all in WBA programs, so that doesn't matter. But at least you're working towards a full registration. You would have learned efficient work. So when I was working with IMGs, I always noticed a stark difference between the performance of an IMG to that of a local trained graduate. They were very efficient. They would clinically prioritize. They would be doing things on the go, including referrals, charting medications, and everything. And I try to learn and incorporate those things. So I want to be a fast and efficient doctor when I'm on the floor. Because what it leads to, it generates good references. So whenever you're applying for a good job, good hospitals, these things matter. These things count. Ideally or desirably, you should be looking for 6 months in ED or medicine, cumulative. You may like to work in ICU. please make a rule of doing one exam or one course per every year. This is the most important thing. Attend a conference. It's like investing in your own future. And obviously, as I said, that you might be a part of a WBA program right now. Now, what if you're a medical specialist oriented? You want to do medical specialization. Obviously, you've done all those right things. Think about getting a critical care job. Think about having some publications if you want to become a cardiologist or respiratory physician, or, you know, for some certain niche specialties, they are doing PhDs now for cardiology and for respiratory medicine. Now, that's not the PhD before getting onto the training, but I'm just talking about getting onto a BPT or basic physician's training. Do an audit. They're a lot simpler than they sound. It would be just a quick survey and comparing it to the national published guidelines. It would look good on your CV. You're working in an Australian hospital. These are the kind of things we should be utilizing to make your CV stand out from the rest of the pack. What if you're surgically inclined? There's no reason why you cannot join surgery. Absolutely no reason at all. So you should be just planning these things right from the beginning. You should be working as surgical RMO. Some of you may have already done, like I've heard someone who's working as a surgical RMO. You may have to spend some time in ED and critical care, full registration. You may have to do a dedicated position in rural settings. Now, most of the surgical registrar, I'm surprised to see, they have got a very strong teaching portfolio. So if you've got, if you teach medical student or junior doctors, that should show up on your CV. You should have excellent references, needless to say, presentation, surgical examinations, primary exams. PhD or MD, I won't rank them as much desirable as much as the rest of the important things are there. And sometimes, the surgeons spend like 2 or 3 years on top of their basic RMO, 2 or 4 years to stand out from the rest of the crowd. And finally, critical care. If you're thinking about ED, ICU, and anesthesia, it's ideal to have that dedicated experience. So when I was talking about that doctor who got in to the anesthesia training, she did 12 months of critical care, that is ICU in Liverpool Hospital. She made all the right connections, tried to understand the process of recruitment, interviewed very well. She, I think, presented at one of the local conferences as well, had one audit done, and she was accepted into the NHS in the anesthesia training. So there's nothing which is preventing you not to do what you think that you can do apart from your own motivation. Okay. What about GPs? So the GP's got certain pathways. So GP has got AGPT program. It's got specialist recognition pathway, which is not we currently discuss. It's got PESCI interview pathway and fellowship support program. So either most of you would be joining AGPT program or a fellowship support program. I won't go much into the details about that program, but these are the programs which you can pretty much join after getting your general registration, both fellowship support program and AGPT program. Fellowship support program I like because they are still not that much rurally placed compared to EGPT because they're self-financed. So significant, I think the whole cost of the fellowship support program is close to about $30,000, but you'd be earning as a GP doctor as well. And the salary is actually much better compared to, a GP registrar whose salary would be taking a downward dive. So you would often seen a GP registrar doing locums to substantiate for their incomes. So be mindful of that when you're training as a GP registrar, they'll be doing locums a lot. Now, there is a website, Map My Career. Okay, so let me show you that website. Just give me.
Can we do one part-time like as a GP and part-time as one of the other specialty?
You can. I would not advise that because you can neither be here nor there. You need to do your training very well. So if you're training in emergency or you're training in general practice and trying to do that at the same time, the best outcome would be to co-register with one college and do a second fellowship if you're that much committed. But if you want to train as a GP and do some locum work in emergency, then you can pretty much all do that. I've seen many doctors who are working as GP VMOs in emergency department. They haven't got any proper qualifications in terms of being an emergency medicine specialist, but they're working as a GP VMOs because there are hardly any doctors to fulfill that position. So they just, because they've worked or spent time in emergency, they can work there because of their skill set. Now, there are certification and diplomas available in Australian College of Emergency website, and you can do those diplomas, which are assessment-based diplomas and assessment-based certification, and you can easily do that. Now, let's talk about something serious now, applying for a career. So you'd be applying for a job, like career-oriented job, each state and recruitment. I'll get Dr. Simra to talk about this because she's prepared that session, and I'll jump in from time to time. So, Dr. Simra, would you like to take over from here for
Yes,
quickly?
sure.
Yeah, I'll
Okay.
flip the sites for you. So just let me know, and I'll flip.
Okay, so over here we are talking about those who are already in the system, right?
Yes, they're all WBA programs.
Yeah. So look, I will always relate this pathway with experience. And if you are starting with your work-based assessment day one, and you know that in the next 12 months you are going to have your journal registration. So what's your plan after that? And what and how you are going to perform in this next 12 months? I know there are particular fixed rotations which we have to do in work-based assessment, including medicine, general surgery, and I think emergency department, yes. But apart from that, just focused on what other specialty you want to focus, that would definitely help you to get into the system. When I talk about training pathways, so training pathways has got their timeline every year when the campaigns open for that as well. So if I talk about myself, I started my work-based assessment in 2022 April, and I finished my work-based assessment in June 2023. I was clear that I need to start, I have to apply for my psychiatry training in next year, 2024. And I know that the applications are opening from 2023 July, which was just after 20 days of my GR. So I planned my year ahead. I did some side rotations. I built some good referees, which will give me a good reference. And apart from that, I was liaising with one of the doctors in NSW who are already working as a psychiatry registrars in the hospitals. So I know what I exactly have to do. And from there, I move forward, applied smartly. So it's just like your career planning. When we do our career sessions with our students, so when I talked to them and made a progress report for them, like when they joined me and asked me that I have to apply as a JMO1. So I always plan their year ahead for the next 6 years. And I tell them, okay, in 2030, I want you to be here. So that you're focused, you're clear. So if you're talking about like specialities, general surgery, BPT, psychiatry, and other specialities, always, first of all, every state has got their own campaigns. Every state has got their own training plans. Perth, Victoria, NSW, ACT, Queensland, and Darwin. This is something which is happening every year. It's about your reference, where you want to start your plan. Victoria, NSW, usually they all start after June. So you have to make sure that you are in liaise with the person who is affiliated with the college and who is going to help you with the questions. If most of you are working and wants to prefer your career in AGPT, so you need to make sure that there will be an entry test. If you need to apply for exemption, what are the criteria for that? And if you have to prepare yourself for interview, how you will go further from there. So that you have 12 months to prepare yourself, your journal according to that. According to that, you can have as like RMO, HMO, SRMO. So like unaccredited trainee is actually for those persons who want to go further in surgery, anesthesia, psychiatry, or in other specialty. So sometimes, like for me, if you will ask me, my plan was to focus unaccredited trainee jobs and trainee jobs in NSW because I really want to come relocate back with my family. So I applied all unaccredited training positions, and I also applied training positions. If I get training position, that's my luck. But if not, then I'm already coming into the system so that next year I'm stepping up with my career and I know what I have to do. So I'm well aware so that if I'm going to shortlist for interview, I have to tell what I have done. And I always remember when I was applying for jobs, I was a junior HMO IMG. I attended one session and I still remember that he was sharing his story. And I think that really inspired me that, okay, if you're not getting a job or a training in the next 12 months, that's all right. But what you have done in that 12 months, I want 12 months record. And I think he went to some interview and he got a big file with his credentials, like I have done this. And when I was applying for my training, I remember my interview with the college, and luckily I was among 100 students Like if there are 70 local graduates, I'm the only IMG who got into the training this year. Why? Because I don't have any connections in SW. I have never worked in an SW, but I always relate my experience in the interview. We will talk about that later on, but unaccredited training position is mostly important for people who want to pursue their career in surgery and anesthesia. I have seen a very flat and a very negative feedback from seniors. Surgery, okay, forget about it. I have met many surgeons, IMGs, who are currently getting into the training. Why? First of all, they are focusing regional sectors, not metro sectors in the start. Because of course, metro is sometimes competitive until unless you are not working as an unaccredited over there for next 5 years, 6 years. But if you're working there dedicatedly, you're managing your logbook, how many cases you have done, how many this surgeries you have done, how many performances, presentations, and how active you are, that will definitely help you to get shortlisted. And I
That is a very
believe
good point.
yeah, so I believe this is one of the very important things which you always have to make sure that whatever you are doing, I was IMG representative in Victoria last year as well. And I always talk to IMGs, okay, if I'm going to work today and coming back home, I want to write what I have done today. It's not just like I did my GMO job because I want money, fortnightly salary came and that's it. It's just like wasting your time. So you have to be focused, and that's how you will compete with the local graduates in Australia.
Now, we'll just
So
quickly
that's
talk about career gaps. Thanks for that,
yeah,
Dr. Simra. I'll invite you once again.
sure.
So look, I mean, obviously you've gone past this scenario, but I just want to touch base that if you've got previous career gaps, you can often convert those gaps into your strengths if you were doing, and that includes everything. And Dr. Simra is a perfect example. She worked in childcare, she worked in vaccination hubs, she worked in during the peak of the COVID times while looking for a first job.
Receptionist,
And I think
yeah,
all these things help build skills, communication, credentials when it comes to the more niche jobs. Her CV might weigh now more heavily because of those extra skills that she's got as a medical receptionist, vaccinator, childcare worker, communication, interaction, empathy building. Why we to tend to ignore these facts? So even though you're beyond that, but if you've got previous career gap, try think of the ways how you can convert them into your strength rather than weaknesses. They should show up on your CVs rather than just a blank slate that, oh, I was migrating into Australia and there was nothing happening. Don't be afraid and ashamed of your past. Be proud of that. You were earning legitimately, and so you were learning legitimately. All right. Now,
it's a really good point.
yeah, exactly. And the other thing is that, you need to justify. And as I said, nothing is off bounds. Even working in Woolworths or Coles is fine. Customer satisfaction, customer care, making sure everybody's handled. There's lots of elderly people who come who cannot reach out the shelves. I recently came across a local graduate, a local Australian graduate who said that I was working in a McDonald's during my medical student days and before my internship days. So everything counts. Make it count for you. Clinical observerships, if you've done, make sure they're reflected well on your CV. It's not just a clinical observership. There's a lot going on in there. Have they dropped off?
No, I can see here 7 candidates.
No,
Seven
I
can.
think okay.
Everyone is here.
Okay, everything's okay.
Yeah,
Their cameras just
Yeah, all good.
they can. Okay, we keep on going. Now, English test, you may have already done that, so we won't go into the details of that. Now, let's focus on CV. And
Sorry, Rizwan, I
yeah,
just raised one question. If you can just go back to the last slide. English exam. So I always checked IMGs as Rizwan is getting forward with the resume. I just want to add one point. I think me and Rizwan have done hundreds of resumes checked. So what I have recently found, the feedback from the training positions and from the senior positions, IMGs used to write their scores. Of course, if they're getting 75 plus in PTE, okay, that's a really good score. But recently I have listened from my students and the feedback from the recruiters and the training positions that, oh, you have got 75 plus score. I think you are not meeting the criteria with the local graduates, and that's why we are not going to give you this position. So I always tell my students, okay, if you have done this exam, that's really good, to not mention your scores into your resume. And that's one of the barrier which I have recently found with many IMGs, and they actually got this feedback as well. So I was not aware of this thing before because IELTS and everything has got good score. But even if you have good score, just write your passed or failed. That's it.
Wonderful. That's a very good point, Dr. Simra. Even I didn't know at that point. Okay.
Yeah, exactly.
So, okay, all right. So there's a feedback coming in. Can still hear, but no more ports for the camera to work. Sorry, that's okay as long as you can see me and hear me. I think that's all that matters. Um, Now let's talk a little bit about CV. And I'm a simplistic man. And I think what me and Dr. Simra have worked out to be the simple the CV and the framework of CV is, the better its impact. Now, I've conducted about close to about 150, 160 one-on-one session, and same, Dr. Simra, you've done one-on-one sessions. And one of the things which I've consistently found in people who are shortlisted for good job interviews in Sydney, in Melbourne, are their simplistic CV designs. This simple language. They are decorated with credentials, not with fonts and tables and colors and photographs. It's see, let your CV do the talking. So let's just go with the framework. CV needs content and credentials and a simple format. I would say that. Now, some basic ideas: keep it simple, Arial, bold headings, black and white, no graphics or photos. Avoid tables and lines unless you have to, convey a lot of information in a short, repeatable format. 2 to 3 sections per page, and then obviously last page could be your reference page. And you can start off with simple details. People often write their full addresses. There's not a requirement. Just put out your city and postcode, your email and mobile phone numbers. All that matters. Now, when it comes to your qualification, you need to make sure that everything that you've done stands out and catches the eye. So put out everything which matters. If you've done any postgraduate qualification, might be an undergraduate course or a postgraduate course, just put it out there. Your MCQ and clinical and WBA component when you've completed your overseas medical registration. They're all important information because they're still valid, your registration. You're working with children. These are the basic fundamentals. And if you've got any awards, intern awards, resident awards, if you've been appreciated for a poster or, an international conference presentation, make sure it shows up on the first page. I had to sometimes literally dig out that information when I'm doing one-on-one session. That, have you got any award? Oh yes, doctor, I've got like 4 or 5 awards. Why is it not showing on the first page? That is your unique selling point. Okay, so think about if you've done and achieved something, even at an undergraduate level, make sure it comes over here. Clinical experience. Now that's where the magic happens. Obviously, you need to put down the month and the year, and also, highlight how many months or years you were working for. And I think it's very important to lay a little bit of information about what you're coming and what you did in that role, especially if your experience is overseas and much more relevant overseas. And I'll tell you why. Recently, I've been accessing lots of GPs and overseas specialists, neurosurgeons, and orthopedic surgeon, ENT specialist, and cardiologist with a specialty assessment process with Medical Board of Australia and specialist colleges. The detail that they require in their application of assessment of specialist is amazing. It's about your clinical responsibilities, your non-clinical responsibilities, your managerial responsibilities, your administrative responsibilities, and they restrict you, which is the most beautiful part. They say, don't go beyond 5 lines. And now you have to get super creative to justify everything in 5 or 6 lines and then move on to the next job. So we have developed a skill or a way to show a transition that, look, one job credentials should not be replicated. It must show a transition of growth, that when you were working as an RMO in geriatrics should be a different experience when you were working as an RMO in neurology or cardiology. So it gives a reader an idea that you've learned from every job. And also, you need to repeat that process with each and every job all the way right up to your intern level. Dr. Simra, you want to add something?
I think, yes, all good. That
Okay.
strengths and experience really matters a lot. And yes, resume should be very simple, but very weightage. Like, let's suppose if I have to apply for psychiatry training, I've worked 4 months in psychiatry, and then it was on the top. It's not about responsibility, doing ward rounds, taking orders, following up with patients. No, I don't like this in my resume. That will not help me to get shortlisted. I have attended more than 20 ECT sessions every month. Every week, I am doing clozapine clinics, which include more than 30 patients face to face. Apart from that, I'm doing some meetings. So, like, what is the weightage of the training which will help me to shortlist? That should be in your responsibilities, and that will help you. Not history taking work rounds. Okay, that's good when you're going for your first job as a GMO intern level. That's what supposed you have to do. But if you're going to apply for SRMO, registrar, and accredited positions, you should be mindful what are you writing in your resume, and that should be your strengths.
That's good. The clinical procedure, I've seen sometimes people wasting huge real estate on CV, like putting down cannulation. Everybody expects you to have that kind of skills once you've done your WBA program, okay? So talk about more mature skills like airway management, your BLS and ALSs, your courses that you've done, your another niche is things that you can do. And everybody, have you got some unique skill set? Make sure it's mentioned on the CV. As I said, 1 to 2 courses per year should be an absolute must. Even if you want to become, there's a huge difference between a good GP and an average GP. Why don't you become a good GP? 2 courses, 2 resuscitation courses, 2 emergency courses. You might be first placed in a very rural town where you might be the only doctor servicing a large population. So make sure that your courses and CPD activities are mentioned very well. Now, non-clinical experience teaching, if you've done any, if you've been a roster coordinator for interns, if you've got any M&M presentations, think about it and, maintain a log or a journal so you can write down these little things. Everybody's got an access to technology on iPhones. You can just write a note that this is the things that I've done new today. And when you're redoing your CV for a better job, these things can show up on your CV. Oh, I did this new referral today, which was a reflective learning on this point in terms of prioritization, because we had post-take patients of 30 list, but I was able to prioritize them very well. Clinical prioritization, you can talk about that during your interview as well. Even if you've captained a men's soccer team or trained a men's soccer team for children, it's fine. It can mention anywhere, back overseas, back here. It shows your organization skills, your commitment, your discipline of regularity of maintaining that team and following that team through a season. So it shows a great deal. Now, when you're getting your references, make sure your references are aware and they're mentioned professionally in terms of your email and phone. Overseas references sometimes may have be difficult to reach out. So just make sure that tell them to expect an email for your training position or for your job that you might be applying. Now, I would like to say that there is no better person apart from yourself who can tell your own story. And that's exactly what I'm talking about, medical interviews. It's your own story in your own words, through your examples and experiences. Trust me, everything looking great on CV, you've applied for the jobs, everything's looking pitch perfect, but you won't make it through until they hear you and perform during the interview. And that's what makes a key and crucial difference. It's like, short stories. So interviews are decided into, personal questions. Why do you want this job? There's some behavioral questions of scenarios of, conflicts and emergency situations, some clinical scenarios, some clinical governance of complaints and all that kind of thing. And there are all little stories. And I would like you and actively encourage you to go and dig out those stories from your careers. You may have done something, you may have saved a life, you helped save a life, you may have had a very good or very good outcome about your patient who had a very complicated procedure and you were able to pick up something. These are interview bits that must come out during your interview. You must find a reason to tell that part of your success story. It's very important. Now, you'd be interviewed by about 4 or 5 people. Director of pre-vocational training, medical services, medical consultant, human resources manager, and they'll all ask a question to score you. And most of the interviews are scored now. And if you score, they're like mini OSCEs and Vivas. And if you scored well, then you obviously will get a job. that you're aiming for. So sit upright and smile as I'm sitting right now, as Dr. Simra is sitting right now. Upright, look into the camera, listen carefully. And I often say, like when I'm doing one-on-one interview session, that look, when you listen carefully, you're able to articulate a better response and break down your answer into 3 points. Sometimes I just see people verbatim, just reproducing all that what is written on their CV. That's not required. You start out with a very interesting lead, like this is a very interesting question, and I've got the right experience and a story to tell from the last hospital and the position that I was working in. In fact, I was on call at a very busy night shift. You see how much interest I've extracted from you? That is the kind of motivation and skill set you require. Sorry, Dr. Simra, you were going to say something?
No, all good. You can
All
continue.
good.
I will
All
add
right.
on with examples.
Okay. So, question, break it down. Heading is your hook. So, whenever you read up a novel or a book, the first few paragraphs is a hook which grabs your attention. A biography is never going to start, I was born in a small town called this, and that. It will always start with a peak performance. A movie always starts with a peak height of excitement, and then it will try to unravel the rest of the bits and bobs. Give your examples. As I said, there is bound to be something good about your CV or experience, even as you're working right now, in Queensland or wherever you're working. And summarize. At the end, they may forget about what you've told them. Summarize that, look, this is what I learned from that experience, this is what I established from that experience. All right. Dr. Simra, I'll get you to talk about the scenario. I'll just take a quick break here.
Sure. So if I just talk about interview basic guidelines, and that would be great if we can discuss today. I always ask candidates, first of all, candidates look for the questions on the group. I always appreciate that. Okay, that give you a feedback and an idea how to perform in the questions and the answers. But always remember, there will be one introduction question, there will be one clinical question, and there will be one ethical question. So you should have a basic idea as you are currently working. That makes your 75% job easy. If I'm talking about define about yourself. So if you are currently working in one of the hospitals in Queensland, I have heard you guys were saying that working in emergency for 3 years, now doing work-based assessment, and that's really good that you have got a good experience. So now how you will tell about this experience. I will give you one trick example and one across example. I have seen students even getting their journal registration, fail their interviews. Like you're very confident, I have journal registration, now I will get a job. Of course, yes. But if you have the journal registration, are you reflecting that in your personality when you're talking as well? Are you that confident enough? You have to learn that skill. So if you talk to me, the reason why I will fail this interview, sometimes students say that, hi, I'm one of the doctors working in Queensland. I have done work-based assessment, got my journal registration. I'm looking for this position because I'm interested. I want to look forward in my career and it will definitely help me. No, I think this will definitely fail you. But if I want to shortlist you, my answer will be sitting straight, having a good expression, confident, you have journal registration. So that's your choice, right? You have to gain this. Good afternoon. My name is Simra. I'm one of the doctors working in Queensland, and that's one of the regional hospital. And I think that's really helped me to gain skills. And I got some good key set skills. I have got my journal registration recently. I have worked in different departments. That give me definitely a good experience, and that's why I look to move forward in my career. I'm looking that reason I have applied for one of the registrar position in your hospital because I want to grow further. I want to expand my knowledge and what I have gained in this last 1 year and 2 years. I want to put that strength and skills into your position as well. In future, my goal is to, of course, start working as a registrar, and this will not stop me. I will keep moving forward, applying for some training positions, and I think your hospital offers some training options as well. So that would be great for me and for you as well. So I think that would be my goal, and I'm definitely looking for this role. It's like you have worked in a rural setting, you have to tell that. That's one of the key things. What you have done in the last 2 years, tell that. Why you want to work in that hospital. I always talk to my students, we always got fascinated when we see a very good ad and advertisement. We're like, oh, I want to buy this product because even that product is not that good compared to the other product. But why I want to spend more money on that product? Advertisement is so good. They're telling a lot about themselves. They will never tell about their weakness. So self-doubt zero, and always tell about your strengths and skills. So that will definitely help you to get shortlisted and go further.
Wonderful. I'll jump onto the clinical scenario, which seems to be an Achilles heel when it comes to approaching, and most of the clinical scenarios would be there in most of the interviews, like whether applying for consultant job or registrar job, resident job or training job, even for specialist assessment or GP jobs, there will be clinical scenarios. And I've got a very simple way of doing that. Whenever you get asked a clinical scenario, think it about in three. I like the combination of three. So say, for instance, we're dealing with a scenario. I think I've got a scenario. Yes. So let's use this scenario as an example. Okay, just give me a second. Dr. Simra, I'll get you to
Yes.
talk and just give the broad brushstrokes. There's someone on the door. I'll let them in and then I'll resume from here.
Okay, so students always get confused when the clinical scenario came, but no, we always use some approach. I think it would be more easy for us when we have worked already 65-year-old patient through emergency department and yesterday with exhibition of COPD, right? His condition has suddenly deteriorated with some shortness of breath and hypoxia. Okay, saturation is at 80% and currently on nasal prongs, blood pressure, which is of course hypertension. Temperature 39.5. Here we go. He is febrile, probably having sepsis. Tachycardic, yes, because having a high-grade fever. GCS 15, which is a good thing. What will be your approach as the medical officer and how you will go further from there? So always start, okay, as the patient is having said 80%, 65-year-old, background of COPD, it's a medical emergency. I will call for help. I will make sure my patient is on a monitored area, and then I will move forward from there with my ABCD approach. So, like if you have got this kind of start where you are involving some team that will reflect your teamwork, that patient is having SATs of 80% and BP of 80/60, which means it's a sepsis criteria. So you don't have to waste your time. You have to be quick as early as possible. Moving forward, like, of course, I will look for the airway, whether it's patent. I will look for the saturation. Okay, the patient is 80% at this stage, hypoxic. I will quickly attach oxygen. And as the patient is already on nasal prong, I will ask my nurse to quickly do a VBG to know of the status of the patient. Blood pressure is 80/60. So I will move forward from there. As my Rizwan, do you want to continue or should I just go forward?
Okay, I'll take over. So basically, Dr. Simra, you're exactly on the right trajectory. It's about having an opening statement with differential. So say that, look, think about the scenario and say that, look, okay, fine, this is a 65-year-old patient who's got exacerbation of COPD, probably an infective exacerbation. He's got a bit of septic shock going on in there. What could else be wrong there? All right. Okay. He could have a pneumothorax. He may have an acute coronary syndrome. He may have sepsis somewhere else. There could be a range of other possibilities. So start by articulating it with this middle-aged to elderly patient has most likely got an infective exacerbation of COPD. The other differentials would be an acute coronary syndrome, pulmonary embolism, or even a pneumothorax. He is not stable. I'll immediately call for help and move the patient to resuscitation in the meantime. That's your heading. That's your hook. When you say it like that, they immediately recognize he got it. He understands the scenario. Next heading, goals of care. What are goals of care? You look and focus on the key problems here: hypoxia, hypotension, temperature, tachycardia, elderly gentlemen. Okay, so you focus on that. Hypoxia, problem. Solution, oxygen. Hypotension, 80/60. Solution, IV fluids. Temperature, 39. Antipyretics, but early goal-directed antibiotic therapy. Think about sepsis. Early antibiotics, the key. Tachycardia, yes. Tachycardia is there, but he is in shock, so he needs fluid resuscitation and ongoing fluid resuscitation and monitoring. So when you said that, look, I've got a set of problems. This patient is hypoxic and I need to give him titrated oxygen. Be mindful of his COPD. Make sure that don't give him PCO2 retention. He's hypotensive, so he needs IV fluid titrated to his urine output. He's febrile, which means that he's in septic shock. So I need to give him early goal-directed antitherapy as soon as I collect the blood cultures, but I won't delay the antibiotics for that. Now, there is one more problem here, which I called it P, the hidden problem. When you got a relative in the hospital who's deteriorated, you want their patient's relative, personnel. So call the person that is a patient relative. Call your consultant. Call the med team. P is for personnel. It's often the hidden problem, which you may forget about in the heat of the interview, but think about that problem. The last problem being P. Call the patient relative, call the patient, call the senior registrar, call the med team, call your consultant. Trust me, in these 30 seconds, you've passed 90% of the clinical scenario. Now, the last part is detail. Now, you can start off with move the patient into a safe space in a resuscitation, team-oriented approach, cannulation, oxygen, bronchodilator, steroids, oxygen, talking to the patient, explaining, getting the investigation, the VBG, the full blood count, the CRP, the blood cultures. That's the boring bit. It is important, but it's a boring bit. You have informed everything right from the very beginning point. So put the juicy bits out on the top. And trust me, this is the approach that I use for specialist and consultant interviews.
Yes.
Okay. And that's what matters 100% of the time.
Then they get it like this patient is not going to die if he is the doctor because he know what are the differential which will make him die at this stage.
It's all about differential. It's all about
Yeah.
being a safe doctor. Now, you'll get plenty of questions about complaints and conflict. Like, there's a complaint being made against you and what did you learn from it? We tend to focus about the complaint. So when I was initially doing the interview sort of practice with the doctors, they would talk like 3 minutes about a complaint. And when I say, okay, fine, what's your learning? Then there would be no learning. Focus on the learning first. Look, there was a particular incident. Don't use the word complaint. Say there was a particular incident because not many of us would have had complaints. So you can say there was a particular incident which was particularly insightful in building up my both professional credentials and highlight the importance of communication or highlight the importance of proper documentation, highlight the importance of clinical prioritization, whatever your learning might be in that case. By saying that, you are saying that there was an opportunity to learn rather than focusing on a complaint and say, oh, I was made to punish and that's what I learned. No, we want to highlight there was an opportunity to learn from this incident. And that could be any incident. There was a busy department. We had lots of patients and I was able to learn about clinical prioritization because there was one particular patient who was in desperate need of help. And I was able to prioritize because there was a feedback given from the family that he was not attended well, or he was missed, or he was ignored. And often these subtle things make you realize that how important and valuable the clinical prioritization is. There's a patient who felt in a very busy environment that he is not being addressed and his needs are not being addressed properly. And that's why he put a complaint. I realized it was because of miscommunication. Despite the fact I was doing everything correctly, nobody was actually going and explaining to him what we're going to do. So that is another major important point, the communication and closing the loop of communication. There will be questions about, incident. So there's an incident, there'll be hypothetical scenario that there's a critical incident. And what did you learn from that clinical incident, or how would you manage? And say, for instance, particular, there's a patient who represent after being in emergency 5 days ago with a left ankle injury. He was reviewed by another doctor who performed the X-ray, informed the patient everything's good, and now he's represented with an ongoing pain. And the X-ray now shows that he's got a talar dome fracture, and the patient's very upset and wants to lodge a complaint. So everybody will automatically start focusing on the complaint side of things. He's in pain. He's got swelling. Analgesia first, medical management first. But before you start even doing that, apologize to the patient. Say, look, I'm genuinely sorry. You came initially and we missed this X-ray, missed this pathology on the X-ray. We will look into that matter. And I often use a mnemonic AEIOU, apologize, escalation of medical care for E, I is for incident reporting, meaning like you document so that this matter can be investigated in detail. That is I. O is offering an explanation after conducting all that detailed inquiry and root cause analysis. And U is for upskilling. That how does it help you improve your current workflow system? both personally or at professional organization level. So this is all very valid and important. There would be, so that's what I've said: apology, escalate medical care and notification, investigation of the matter, offering explanation, and upskilling. Now, there's often criteria questions about how would you adjust to an Australian or regional. So you might be applying for a job in a completely different state or completely different hospital and say, oh, look, we are very busy. How would you adjust to our challenges? We get a lot of patients. Often they're very sick. How would you adjust? They're not really interested in you've worked in a very cowboy situation before. What they want to hear is that you're a quick learner and you're healthy you're willing to adapt. You've got a healthy mind and healthy mindset to be able to adapt to new challenges. That's what is behind that question. So no matter how challenging that specialty is, or no matter how challenging that hospital is, they want to know and learn about whether you are healthy enough to adapt to new changing situations rapidly. That's the question. Career gaps, as I said before, and we've covered it, that cover them. There's nothing which, should be left out to their imagination. Oh, he was not practicing. I'm not sure what he was doing for those 3 years or 4 years or 3 months for that matter. So just make sure that everything is mentioned up to the detail. There's lots of question which comes in clinical governance. Some of them you already talked about, like complaints management. That's a part of clinical governance. What about quality improvement? So when they get quality improvement, like, have you done any clinical governance project, like an audit or research or teaching, or everybody gets sort of, oh, what are they asking about? They're just asking about if you're a safe doctor, number one. Or number two, have you got any skills which would reflect towards the quality improvement? Safe doctor being, even handing over your patients. So if you hand over your patients, that's what they want to know. If you document allergies, that's what they want to know. If you prioritize patients with neutropenic sepsis, that's what they want to know. That's all safe practices. If you want to escalate a deteriorating patient to your consultant or senior, that's what they want to know. Okay. And quality improvement, if you've done an audit project, that's what I'm saying. Audits are very easy to do. If you've done any audit project, mention it to them. I've done this audit, or I've done this presentation. Right now, I'm doing this presentation to you. If you've done similar kind of presentation on certain topics like pancreatitis or whatever it is, can you not talk about that as a quality improvement? You've improved the insights of some junior medical officer by giving them a latest guidelines about pain management in pancreatitis or investigative approaches in acute abdomen. That's all quality improvement. All right. Then they will give you a opportunity at the end. Ask a question from us. What do you have? And often people say to me that, look, this question might be, Dr. Simra, what do you think? What what questions, like, people come in with that, oh, have I got the job? Or what?
Yes.
So this
They
is a
always get
very important question.
confused. I always tell them, like, look, you have got experience, you are eligible for this position. So why are you just getting doubtful and like feeling flat when they're asking, do you have any questions? If I think I will definitely ask, okay, if I'm getting this training positions, what will be the rosters and where I'm going to be rotated? I am keen to do my work, but I'm really focused on my education as well. So what will be the teaching facilities going to be offered that will help me to progress in my career? Because I know I have a skill, I am eligible for this position. So why should I doubt myself? I should know like how this job will going to help me to progress in my career. So be confident and ask. Like sometimes students ask, okay, I'm happy to listen the feedback when it's going to be. Why you want to listen the feedback? If you perform good, definitely this job is yours. You should ask something different, like job position, like education, progress in career, rotations, and that would definitely makes a difference.
And I think something more relevant to the job, think about
Yeah,
something new. Why are we afraid to have our own questions?
exactly.
Like, think about, what does this job involve in terms of on-call commitments? Like, what kind of supervision will I have coming into this new environment?
Yeah.
Do you have registrar on call? Do you have consultant who's approachable by the phone? Can I have a hospital accommodation? What are your hospital quarters like for JMO who are spending night duties there? These are all questions which show your interest in the job. Maybe you've done research and then you can ask for research, but asking for research when you've got no research in your CV
Oh
is
no.
just saying that, look, oh, I'm just asking this question to sound like I've got, I want to just sound like I'm interested, but I'm not really sure what I'm talking about. So just be very clear in terms of your point. And above all, practice is the key. And that's
Exactly.
why, yeah, that's why it's very important to talk to each other. Practice interview with the people who are professional, with the people who've been doing it for the long time, or even sometimes in front of the mirror, talking between, yourselves, various scenarios, time managing yourself. There's a lot you can learn on a self-discovery pathway. We've just gone through like whole of the interview. This is exactly the interview you'd get as a consultant, registrar, junior medical officer, trainee. All of these questions would be exactly in that same format, in obviously a varying
Yeah.
amount of information. So practice it and make your own questions. Sometimes,
Yes.
you need to sneak in the things. As I said, it's your own story. You need to tell the best bits of your story somehow. You need to find a reason to say that, look, I saved a life of a little baby who nobody was able to candlelight, but I was able to put a candle in. That's a story that
Yes.
must somehow come in your interview.
And
Okay.
I will just add on, like the group me and Rizwan running with some career sessions on weekly basis. We are doing that, and we are doing interviews practice every week. I remember I was doing an interview randomly asking my students question. One of the girl from Sri Lanka told me that she was very quiet, but I just randomly asked her one question, and then she told me that, oh, she has worked in Sri Lanka when there was where she used to travel in a boat to see patients in a GP sector somewhere in a really rural area where there is no transport. And I was like, here you go, like this is something really important, and I want you to frame this question, and then let's do a mock interview. And recently, I just got her like message that she got a job in 3 sectors in Queensland. And she
Oh,
said
wow.
everyone was surprised listening her example, going and traveling in a boat to see a patient in one of a very rural area. So that's what we are doing on weekly basis. And like I always say my students, like this is not like we are helping with resume, selection criteria, and application forms. We are building you as a strong candidate so that you can stand out when you're working with a local graduate. You're not having a very flat face and you are not that confident. You have worked more than that. You should speak like a boss. You're not. So we are shaping you like that so that you're a strong candidate and you're telling about your strengths and skills.
On the same note, Simra, I don't know if you remember when we were doing this Liverpool hospital workshop.
Yeah.
There was a doctor from Nepal, and
COVID, yeah.
and we asked the same question to him that, look, how would you address this interview and tell me something unique about your experiences? He told me that there was like one time there was a major road traffic accident with a bus
Yes.
tragedy, and he was working in emergency department, and he was set himself into a little disaster situation. So he
Exactly.
received lots of casualties, lots of fatalities. They built up like immediately a triage and kind of thing, and said, look, kind of experience you've had with 50 casualties is some of the things with even Australian emergency physician would not have had. Now, it
No.
doesn't really matter what was the outcome, but the fact that you have got that experience put you in a unique position, and it must come out. And trust me, after that workshop, he joined as a BPT.
Yes.
And then because it showed every little trait about clinical prioritization, emphasis,
Everything.
resuscitation skills, was amazing. So look, the plan is clear. That's the action plan. If you're working hard right now, make sure every day of your hard work counts. If you want to become a consultant, it's an easy thing to do as long as you're organized and strategic about it. There's good salary, there's good future, uh, there's permanency in jobs, and you can talk to many of the consultants where you're working, and you can compare their lifestyles with the GP lifestyles as well. The GP again is a very flexible lifestyle. If you like working in rural and remote medicine, if you've got that hunger for looking after the patients in that very remote setting, then definitely it is something that you should consider doing. There's always an option of doing private work and locums, whether you're a GP or a consultant. Right now, it looks like there's good opportunities if you want to come and work in a hospital setting in ED, ICU, psychiatry, medicine, and there are lots of people who are coming from everywhere. So just make sure that you are on that trajectory and that pathway wherever you are, that you're trying to make those little steps count early on in your career.
Just one question, Rizwan, I've raised here. I have met many IMGs, and I have definitely talked to you about this before. Like when you were getting your journal registrations, there will be on that side of people who want to fantasize you with locum opportunities. And they're like, oh, take a break, do locum for 2, 3 years, make some money. Okay, we need that. And then they will keep you distracted from your training opportunities, minus your golden years when you just finish your training. So I know, like, you give me a really good answer about that, like how you will, if I'm one of the doctors just waiting for my journal registration, I have 3 months to prepare for the training program. But okay, I'm getting a very fancy locum opportunity right now as well. So how you will differentiate in what you are going to choose?
That is a very good point. I've
Yeah.
seen people destroy their careers just
Yeah.
by being drawn into locums, doing locums in different state, traveling, ignoring their families, ignoring their training, flunking their exam, and losing their training years. And I cannot agree with this point enough. So we've got a website. If you've got any more information, we've got blogs on guidance in terms of career guidance, interviews, CVs, everything. You know our YouTube channel as well, obviously. Courses, CPD. We do workshops now in Liverpool, Wollongong. So if you're interested, more than happy to join. If you've got questions, I'm more than happy to take your questions now. Deathly silence. Okay, there might be something.
Please ask question. You got this one in front of you. That's a golden opportunity. You can ask. It's a good time to go further ahead in your career, and always appreciate to ask questions. I am in my training, but I still have many questions to ask him whenever I find him. When he asks me, do you have any question?
That's okay. Look, if you have got questions, you can always send them to me at info@emergencyfocus.net, and I'll try prioritize an answer for you. So look, I'll just stop sharing my screen. We are nearly done there.
Hi, Ridwan.
Alex.
Hello, yes.
Ridwan, I just have a question. Is that to get into any training program, do you actually need any PR or before that
There is
you
a
can?
requirement. There is a requirement for permanent residency for most colleges, but then again, there could be allowances. So if you've got
Yeah.
general registration, then you can
Mhm.
always negotiate with that particular program that, look, my permanent residency is in a process, but my other credentials are up to the mark. So if given this opportunity, they can give you a conditional offer that once you get your permanent residency in 3 months, 6 months, or whatever time, you can carry on with this program. And that's happening a lot in emergency, ICU,
Yeah.
psychiatry as well.
I don't
And
have PR, and I was unfortunately not make it in my first round. And then I was keen to go into the training, and then I talked to different directors of the training networks. That what was the reason I was not shortlisted, and they said, okay, you don't have permanent residency, but I showed them about my skills and strength. And in the second round, I got my residency. I don't have PR, but they offered me a visa for the next 5 years.
perfect.
And for the whole of the training program, like for the whole of the training program, is there any mandatory requirement that you can't stay in the same place for 3-4 years, or like
Which
you
training
can,
program are we referring to?
like if there is an ED training program or something like the PPT?
So most of the emergency training programs are organized in 2 or 3 hospitals. So there is an urban requirement and there is a rural requirement for emergency. Rural requirement is about 6 months. So if you're training in, say, St. George Hospital, you'll be doing majority of your time and non-emergency training rotations in St. George Hospital, and then you will be sent to do a rural component in Sutherland Hospital, which is still within Sydney. Or if you work in Wollongong, you'll do majority of your training in Wollongong Hospital, and then you'll do a rural component in the hospital 10 kilometers down the road, which is Shellharbour Hospital. So you can pretty much complete all your training within 2 or 3 hospitals. You don't
Yes.
have to, you'll be not forced to go in networks beyond. There was a previous suggestion when I was training, but because hospital needs these critical shortage of doctors, emergency, ICU, they say that, look, we want to keep our trainees to ourselves at this stage. Might that change down the line? I'm not sure about that, but still, for the last 21 years I've been here, I've been seeing the same thing.
Yes, and as far as BPT is concerned and other trainings, if you are going to be a stage 1, okay, you got your contract for the next 5 years, but you always have opportunity to change and apply for BPT 2, 3, or stage 2, 3 in other networks. That's your choice. There is no restriction. So whenever you want, you can take a break. You can either be part-time, you want to change your network. It's full of opportunities. So yes.
And it's good to move up the ladder. I mean, I would
Yeah.
always encourage that, look, every 2 years you should try build up yourself, because when it comes to getting a good consultant level position, it goes and show in your CV that, oh, you work in 4 different hospitals in your training. Why is that? Oh, because I'd like to experience different demographics. I'd like to experience different pathology. One was a center of excellence for neurology and neurospinal injuries. The other was for brain. So I've now seen people deliberately going from Wollongong and St. George to Liverpool Hospital because it's just a very busy trauma center. They've got a case mills and demographics like working in Afghanistan. That's why I still like working there as a consultant, because when I go there, the skills are like pushed to the max. I'll be doing all my patients and critical care skills. It's like I'm back being a registrar. I just completely enjoy my work there. Any other questions, guys?
I have a question. So I think the GP pathway, because it has a shorter training time, like we can get a fellow in 1 to 2 years. But for the other specialties, it takes like 5 to 7 years to get the fellowship. So my question is, like, after I get a fellowship in the GP, and if I want to change my mind, if I want to go to other specialty, so so can we shorter the training time, or do we have to start from the beginning?
So look,
Yeah.
the GP duration time of 24 months is on paper. Reality, I've seen most IMGs spending there close to about 4 years or 4.5 years. So you've got to be very clear about that. There might be some hiccups in terms of your, exams. Exam create a lot of planning. There's 4 components to the GP exam. They're not easy exams. The GP exams are still quite competitive. So they may set you back another couple of years. When it comes to the special training, yes, 5 years. They may again be exams at the end, and they may again set you back to 5 to 7 years. There is no hybrid mode that you can, do the GP and get an exemption, because every program is tailor-made towards their specific training college. So GP will only train you being a GP. Emergency will only train you being an emergency specialist. There are some combined pathways. So now most of the colleges have got combined pathways like ED with pediatrics, ED with ICU, GP with ED for ACRM. So
Rural
there are
generalist.
combined, but they are double fellowships.
Yeah.
They're double fellowships. So you can be a PEM or pediatric emergency medicine specialist by doing an additional 12 to 24 months. That is within specialty. As an emergency, you can, as a GP, you can do ACRM. So they might means that you're working as a rural and remote college physician by doing an additional 12 months in rural and very remote area. So there are certain allowances, but you have to be pretty much switched on and committed to that kind of thing. And, there are exams at the end. You might be doing 2 exams. So be mindful of that.
You
Any
can't
other
escape
questions?
from exams.
No. All right. I think that's about it. I think Dr. Alex, have you got any other things in the hallway which they want to ask, or are we done?
No, I don't think
Dr.
so.
Alex is very happy.
Yeah, thank you for calling me doctor. I appreciate that.
Okay.
Because I'm not.
Oh, I just thought you were a WB coordinator. In the network that I'm working, WB coordinator are normally, a doctor. So that's why I imagine. But that's okay.
I'll take it. I'll definitely take it.
Okay.
Yeah, no, I don't think so. That if you can send the recording through to us, that'd be great once it comes through. But thank you very much for your time.
She's more
Thank you very
powerful.
much.
She can control the
you.
Right. Take care,
Thanks very
guys. See you.
Thank
And
you.
look, happy to engage with you for future references. If you, basically, we've been having a conversation that if we can do that more, what we've done is a quick snapshot. But if you'd like to do it more periodically, we can certainly organize session going more in depth in each of the things that we've talked about. It is not something which we can sort of squeeze in. There's so many things that we'd like to build and work with you. So it's a tremendous opportunity for all us to put our experience and working minds together and take it to the next level. Because I think every one of you, each and every one, has got a potential. And we don't truly know our potential unless and until we tap it. And trust me, it's a lot easier than you think. Every mountain looks very high before you climb it. All right, guys, take care.
Thank
Bye.
you. Bye.
Thank you, Simra.
Bye.